Welcome to the bonus content for the IT band pain episode. In this bonus content, what we're going to do is we're going to go over some treatment options that you can do when you're treating a patient that has IT band pain, and also some rehab ideas that you can think of when you're trying to prescribe their rehab program. So we'll start with some treatment methods. So the first treatment option that we like to go over is cupping or myofascial decompression. So in the episode, we talk about how IT band pain is caused by the compression of the IT band against the lateral femoral epicondyle, the fat pad that sits underneath it, right? So the idea with this decompression is, a lot of our treatments really geared towards compression and pushing and mashing the tissue. This is kind of giving us an opposite of that. Hey, let's decompress the tissue. In the episode, we do talk about how the fascia or the IT band itself doesn't really move a lot. It's really hard to influence its stiffness, but we can at least influence some of the fascia that sits underneath it. And that's where I think myofascial decompression has been very vital in IT band pain, and I've seen a lot of great success with it. How I like to do mine is I like to incorporate a more of a sliding cup technique. So to do this, you'll put the cup on the IT band. Yep, that's great. Once the cup's on the IT band, you don't have to go too crazy with the suction, just because you are going to be moving it. Cupping's already a little uncomfortable sometimes. And then once it's on, you'll go ahead and slide it. And then what you'll do is you basically just kind of alternate going up, down. You can go anterior, posterior, kind of getting all different aspects of the fascia. And what you're trying to feel for is you're trying to feel for the bumpiness and the grittiness of the fascia. If you get a lot of bumpiness, that's a lot of dense fascia that is built up that needs to be smoothed out. Woo! Okay. There are some other techniques for myofascial decompression of the IT band as well. You can see other clinicians putting multiple cups on, where they'll have maybe 4, and then they can have the patient do movements with it. That's one way to also kind of induce some movement with the cup. Instead of the cup moving, the tissue underneath the cups are moving. I personally don't do that one as often. I found a lot of great success with sliding, but if that works for you, and if your patient's like it, I think it's definitely worthwhile to jump into. The next treatment that we want to talk about is instrument-assisted soft tissue mobilization. Like we said with IT band pain, it's definitely a compression, so I don't tend to jump to the instrument assisted, but I do like to use the instrument assisted tools to help with the lining of new collagen, helping promote that inflammation cycle. So when I use scraping for IT band pain, I'll start with the distal insertions of the IT band. So where it's coming off of, where it's starting to go down towards Gertie's tubercle, where there's some connections from the IT band to the patella. And I'll just go very light because a lot of times they'll be pretty tender, so I don't try and go in too much to crush them. Just trying to get that fascia to start promote some healing, get in the collagen to align correctly. Another area that I like to work on is kind of what we talked about in the episode, and what is termed as like your Kaplan fibers. So if you kind of come off of where the biceps femoris tendon would be, and then go anterior to that, and that little space in between the IT band and the biceps femoris, you can kind of start working on some of those smaller attachments from the IT band, since we have talked about how they are important to the actual knee stability that the IT band produces. So the final treatment topic that I want to address is what I like to call the lateral line stretch. So in the episode, we talked about how a lot of literature is saying, hey, don't stretch the IT band. You're not really getting anything out of it. It doesn't really help with the actual pain. Why are we doing it? You don't see a lot of change in length of the IT band. You shouldn't really stretch it. So I think I take that with a caveat with, when you're looking just at the IT band, that may be true. You're not really getting a change in length. Why are we stretching it? So that's why I like to do more of a lateral line stretch, because we're not just stretching that IT band, but we're stretching the entire structures around that lateral line. All of them may have an influence on the IT band itself, like TFL, glute med, obliques, QL, everything that runs a bit, the lats that also run through that lateral line as well. All these muscles, or fascia as well, any adhesions in there can also play a function in IT band tightness or that tension within the IT band. So I still think it is valuable. Just we need to define what we're stretching as opposed to just saying like, oh, we're stretching the IT band. No, maybe we're stretching a little bit more. So to do the lateral line stretch, what I'll do is I'll have them cross their legs. The leg that's being stretched is underneath, so my hand can kind of grasp the ankle and not really go anywhere with the top leg on top. And then the arm of the same side that's being stretched, so in this case her right arm will grab the top left corner of the table. What you'll do is you'll stabilize the pelvis, palm of the hand right over ASIS, and then you just pull into that hip abduction. And now what you're seeing is this whole side bows, creating the stretch throughout the lateral line. You can also get varying degrees of it as well. If you want to start getting a little of that biceps femoris, which we did talk about having some connections to the IT band through the intermuscular septum, you can start getting into a little bit of a hamstring stretch as well, and going that way as well. As with your typical stretching, however you like to do your sets, reps, the classic is always 3 sets, 30 seconds, but you can always play around with the dosage and timing of your stretch. So now that we talked about treatment options for patients with IT band pain, now we want to talk about the exercises. And in the episode, we kind of talked about how you progress from, hey, when they're in like a lot of pain, can't really do much functional things, you really got to start small, maybe doing some stuff on the table. Here's a great way to strengthen those deep external rotators of the hip that can help protect from that dynamic valgus. So in this one, you're going to have them sideline with the leg that you're trying to work on at the bottom. So in this case, the right leg. And then what you do is you have an ankle weight, and then all you're going to have them do is rotate that ankle up into that external rotation and then down. So this is really trying to get those deep external rotators. So the next exercise we want to go over is the single leg glute bridge. If you go back into our FAI bonus content, we talked about the glute bridge, being a treatment option for FAI. In this case, we wanted to talk about a little bit more of a progression where, say, you have someone with IT band pain that's starting to progress pretty well, but they're not quite ready for more closed chain exercises. This is a nice way to still challenge those glutes as well. So with the single leg glute bridge, it's pretty much what it sounds like. You're still going to do like your normal glute bridge. How I like to cue my patients when they do it is, so in this case, we'll use the right leg as the exercise leg. So what I have them do is I have them bend their knee so their heels as close to their butt as they can. And then they'll bring their ankle into dorsiflexion for the exercise leg. And then they'll bring that left leg or the non-exercise leg into hip flexion. And then you just have them go ahead and do their normal bridge. Same cueing, right? We still want the core nice and tight. We still want those glutes to drive that motion and then come back up. Now, again, in the bonus content for the FAI episode, we did talk about a way to modify this to get a little more core of having a band and having them do, go with some, going with bringing their arms down. In this case, you can still use that modification to this exercise as this becomes a little bit easier. One way to do that is you can have the patient grab the stick, and then you'll get a band around the stick, and then I have them start back here a little bit, and then same thing, go ahead and bridge, and as you bridge, you're going to bring the stick closer to your leg. Perfect. And then go ahead.
It's a lot of coordination.
Good. And then you just apply a little resistance, kind of like in that episode how we talked about it. You're not trying to overly challenge them. You're just trying to give a little bit of a stimulus. Good. Relax. Another good thing when they're doing this exercise is also to watch their mechanics as well. You want the pelvis pretty level as it's coming up. You don't want to see one side dropping because that's indicating that there is still some glute med weakness, and you want to start working on that stability as well.
Or transverse abdominis.
Yes, also the transverse abdominis being weak and not being able to control the pelvis as well could indicate that dipping of the pelvis as well. And then the last exercise that we want to show is for the progression. Hey, once we're able to start doing some more closed chain activities, this is a great way to start. Again, in that FAI bonus content, we talked about how the standing hip abduction has great glute activation. One thing that I like to do to kind of change it up is also to add a little extension motion as well to now also get more of the glutes to fire. So how I cue this exercise is I tell them when they're bringing their leg out to the side, they're not going straight to the side, they're not going straight back, they're almost splitting the difference and you're going at an angle. The leg that's down will have a slight bend to it, and then perfect, just like that. The best thing about this exercise is I have them do both sides because both sides are working. The down leg has to resist the band, so not to go into that dynamic valgus. So it's cueing them on proper mechanics in weight bearing as well. As I talked about in the FAI bonus content, I do like to mix in some perturbations or dual tasks where I'm having them catch colored balls. They have to recite what color is coming at them. You can have them do math problems. You can have them count backwards. Any dual task can work as well. So hopefully this bonus content gives you some new ideas or maybe a different way of thinking about how you treat IT band and how you progress their exercises, what exercises to choose next time you have a patient that comes in with IT band pain.